Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that our webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you, Rachel. Good morning, everybody. I was in Washington, D.C. last week, and I am incredibly grateful to be back. For those people who work in Washington, D.C., my hat is off to you, and you can have it. That is a very, very busy place, and I am in awe of anybody who can live in that area, and I'm just amazed at everything that takes place there. But that's not what we're here to talk about today. Let's get into our webinar. Before we do, let me once again remind you that the Medicare Assistance Program is funded through grants through the Administration for Community Living, which provides us funding to go out and educate Oklahomans about Medicare, how Medicare works, and what are your options related to Medicare. What do you do if you've got a problem with your Medicare? So we hope people will give us a call and let us work with you on making decisions related to your Medicare coverage, as well as what to do if you've got any questions or problems related to it, including if there's an issue related to fraud. If you think fraud might be taking place, or if you've got questions about things that you need to be watching for to make sure that you don't become a victim of fraud. Also, for people who may be low income, people who are concerned about affording their Medicare coverage. There are programs that are available that might help you pay your monthly premiums or co-pays and things like that. So any questions related to Medicare, please don't hesitate to give us a call. So now let's get into our topic for this month, which is how Medicare covers prescription medications. There are a lot of medications out there, and how they get covered by Medicare kind of depends on a lot of different factors. So I want to make sure that people understand that not all of your medications are covered the same way. We get a lot of people that will call us uh, concerned or actually angry at sometimes because they just thought that they would turn 65 and everything would roll over and they could go play in the garden or go fishing and everything would just be great because now they were 65 and it would just suddenly happen that all their healthcare needs would be covered. It doesn't quite work that way, folks. So today what we're going to talk about is the prescription drug coverage side of things. So let's get into it. So if you're on Medicare, what's covering your prescription medications? Well, it's going to kind of depend on where you're at the time that you need those prescription meds. If you're on medication, if you need some medications and you're in the hospital, you're laying in a hospital bed and the doctor's treating you for some condition while you're in there, that's going to be covered by your Part A. So maybe you've been admitted to the hospital for some heart condition, or God forbid you've got cancer or something like that. Your Medicare Part A is probably going to be what's covering those medications that you're receiving for that treatment. What about if you're in the doctor's office? You've just gone in for some kind of treatment. In some cases, it could also be for that same cancer treatment, but you're being treated on an outpatient basis. Those medications, quite frequently, are going to be covered by Part B, as in boy. Those medications are covered on that part that's for outpatient stuff. Also, vaccinations. A lot of the vaccinations that we receive are covered by Part B. That's going to include like your flu vaccination. Other vaccinations, like the ones that you get whenever you go to the doctor and the doctor writes out that little prescription on a pad of paper and stuff and sends you to the pharmacy, those are going to be covered most of the time by Part D, as in dog. And that's a different part of Medicare that we're going to get into in a little bit more detail a little bit later. But those are covered through private insurance companies that offer multiple different plans. We're going to talk about that some more in a minute. Some people get them through a Part D plan. Other people might get that through their Medicare Advantage plan. For those people who choose to join an HMO or a PPO or a plan like that, those plans oftentimes include the prescription drug coverage as well. So either they're getting their medication, their outpatient prescription drug coverage through a Part D plan or a Part C plan. In Oklahoma, we currently have 11 different Part D plans available to us. Some of you may remember back in the beginning, we had a lot more than 11 plans. I think I can remember when we had way above 20 different plans that were available in our state in the beginning. Currently, the premiums range in those plans anywhere from zero for a monthly premium for a plan all the way up to $167.30 a month, depending on what's covered by that plan. Some of these plans cover some very expensive medications. So, as you can imagine, those plans may have a higher monthly premium for those drugs that they cover. The maximum deductible that a Part D plan can have in the year 2026 is $615. Now, I can tell you, we've already heard that the deductible for next year is probably going to go up to about $700. So that is going to go up, unfortunately. Now, one thing that's kind of new that only started a year or so ago was the maximum out-of-pocket costs. Prior to that, we had a lot of seniors that were getting hit with a lot of expenses toward the end of the year because they would reach the maximum that their Part D plan would pay, and suddenly they were having to pay full out-of-pocket costs for their prescription medications, and this was very catastrophic for a lot of seniors. But then a couple of years ago, they implemented this maximum out-of-pocket cost, and that meant that once a Medicare beneficiary who was on a Part D plan reached that maximum number, they no longer had to pay for their Part D prescription medications. It started out, it was $2,000 was the out-of-pocket max. That meant that once what they paid out of pocket for their Part D copays reach that maximum amount of money for their deductible and their out-of-pocket copays, then they didn't have to pay anything. In 2026, that maximum amount was up to $2,100. I've also heard that that maximum out of pocket is going to go up as well. In 2027, it will be $2,400. So there's still a phase one kind of drug plan deductible. That means that if your plan has a deductible, now not all plans have a deductible, but if your Part D plan that you're currently enrolled in has a deductible, you're going to have to meet that deductible first before your plan kicks in. Some plans have the $615 deductible. It may have a $250 deductible. It may not have any deductible. But once you meet your deductible, then your plan will kick in and start covering your medications. Now, some plans have a tier structure that says if your drug is a tier one drug, or maybe even a tier two drug, those drugs don't have to pay. They're you don't have to use the deductible. In other words, your plan will cover them even if you haven't met the deductible yet. The deductible may only apply for the higher tier medications. So that's something also that you might want to pay attention to when you're enrolling in those plans for the coming year. Phase two of your drug plan, that's after you've met your deductible and your plan is kicked in. And that's when you're going to start paying the copays for your medication. Most of the time, the Part D plans cover approximately 75% of the cost of your covered medications. So, how much the plan is going to pay is going to depend on which tier that your medication is on. In the beginning, there was usually like a tier one, two, three, and four. Now there's multiple tiers that your medications can be on because there are so many different medications out there, as you well know. Now you'll hear different terminology that's used a lot of times with these medications, copay versus co-insurance. The difference between the two terms is this. A copay is a set amount of money. A copay is a certain dollar amount, $25, $35, $75, something like that. A coinsurance is a percentage, 25%, 50%, 35%. So if you hear somebody reference something in terms of a coinsurance, they're going to be talking to you about a percentage. Your coinsurance on your current plan is 35%. That means whatever the price of the medication is, you're going to be responsible for a percentage of the cost of that drug rather than a copay, which would be you're going to pay $25 toward the cost of that drug. So be aware of that terminology whenever you're talking to somebody about your insurance. Now, once you and your plan have spent that $2,100 combined for drugs, that includes your deductible, your copays and your deductible applied toward that $2,100, then you've met that out of pocket max. And again, next year, that amount's going to be $2,400. So some things that we want people to keep in mind. We typically get the same questions a lot during the year, and we hear a lot of people that are calling with concerns, issues that have come up during the year. Some of the things that tend to pop up a lot. When you're talking about getting a Part D plan, you have to have Part A or Part B. You don't have to have both. We still get people that don't understand that part. Once you lose employer coverage, if you're still working past the age of 65 and you decide you're going to retire, you only have 63 days in which to enroll in a Part D prescription drug plan. This is concerning and confusing to people because once you stop working, you've got up to 8 months to get enrolled in Part B. That's not the case with your Part D. You've only got 63 days. So keep that in mind. There is an annual enrollment period, and this is the same whether you're talking about Medicare Advantage or Part D. It's October 15th through December 7th, and your effective date is still going to be January 1st. Always, 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 whenever you are looking at picking a Part D drug plan, it's not enough just to know the name of your drug. You want to make sure that you're entering the right name, the right dosage, and the frequency. How often are you taking that drug? These things can make a huge difference when you're picking your Part D prescription drug plan. Accuracy is very important in picking the right plan and getting the right prices out of the system to know how much you're going to be paying when you go to the pharmacy. So let's get the information correct, folks. Also, I encourage people to explore pharmacies. I understand people's loyalties to their pharmacies. I'm pretty loyal to mine, but I also understand how the prices of medications is going up every single day. It's important for you to understand the contractual relationships that these drug manufacturers have with different pharmacies. And as consumers, you know, particularly as seniors who aren't getting a raise every year, as we did when we were in the workforce, you want to make sure that you're taking advantage of every opportunity to save money. So I tell people anytime you're looking at your costs related to your prescription medications, you want to make sure that you understand where you can make the most of your income. And so I tell people, enter that information in there and choose several different pharmacies just in case there is that possibility that you could make a significant savings by possibly looking at a different pharmacy. Now, another thing that is important to look at, and something that's going to be a new feature from what I understand on Plan Finder in the coming year. There are some medications out there that, we've all got medications that we like to get in that 90-day supply. You can get a longer supply. You don't have to go to the pharmacy as often. Uh, in some cases, you can save money because you get a 90-day supply for the cost of a 60-day supply. But some medications cannot be filled for the 90-day supply, and that's up to the Part D drug plan. They can decide which ones they're going to fill for 90 days. Some of this is related to cost. Some of those medications, as we said before, really expensive drugs. So the plan may say, we're not going to fill that one for a 90-day supply because guess what? What if your doctor decides you need to change meds? Suddenly we've paid for a 90-day supply and you're not going to use the rest of that medication and we can't take it back. So that med, we're only going to dispense 30 days at a time. So I can understand where they're coming from. So there are going to be some medications you're not going to be able to get for more than 30 days or 60 days or whatever the case may be. So if that's something that's important to you, this is going to be something you're going to be able to look at from what I have understood. This is what we were told last week in Washington. There should be a feature that's going to be available on Plan Finder that will tell us if medications are going to be limited to 30, 60, or 90-day supply when you ask for that prescription. So what if you've got Medicare and you've got other drug coverage? It's important to know what other drug coverage that you've got. Some people don't need Part D. Other people have other drug coverage, but it doesn't necessarily cover all the prescriptions that they might need. So it's important to know what that drug coverage is and how it might coordinate with other drug coverage that they have access to. This is called coordination of benefits, and it's important to know what they've got and who's going to pay first in what circumstances. If they've got employer group coverage, let's say that somebody is still working and they've got employer coverage. This is probably somebody that may not even need Medicare yet. Maybe they can delay starting their Medicare and save having to pay that Part B monthly premium as well as Part D. So it's important to know, is that coverage considered creditable coverage? If so, they can delay having to pay for those premiums and just use that employer coverage. They got their spouse covered, great, they're both covered. Now, who's going to pay first is going to depend on a couple of things. For one thing, what's the size of the employer? If the employer has 20 or more employees, the employer coverage is going to be considered the primary coverage. All right. Now, if the employer has fewer than 20 employees, Medicare is going to be primary. So if it's a small employer, then in that case, that person is going to need to get on Medicare because regardless of whether the person starts Medicare, that employer's insurance is going to treat them as if Medicare is primary and they will only pay as secondary. So it's really not much of a choice. Now, if the beneficiary in question is on Medicare due to disability, it works the same way. What is going to be different is the number of employees. The number of employees in question would jump up to 100 instead of 20. Now, if we're talking about retiree coverage, if we're not talking about active employment anymore, it's going to be a little bit different. Most retiree coverage does include prescription drug coverage. And this can get very, very tricky. We've had people that had drug coverage through their employer, but they got that phone call from somebody that said, hey, we'd like to sell you this drug plan. And a lot of us are, we want to be safe. We want to make sure we got plenty of coverage for our health and stuff. And so they might, purchase that policy. What the heck? It's got a 0 monthly premium. What could it hurt? Well, in the insurance industry, if you purchase another policy, it can accidentally cancel your other coverage. So you don't want to accidentally enroll in other coverage that might terminate your retiree coverage. So be careful about that. Don't enroll in some insurance policy that might terminate your current health coverage because sometimes it doesn't just terminate your drug coverage, it might accidentally terminate your health coverage too. Before you enroll in any kind of health coverage, whether it's drug or health, talk to your retiree people and ask them, what would happen if I enrolled in a Part D plan? What would happen if I enrolled in this dental plan? What would enroll, et cetera, et cetera. Medicare Part D is typically primary over any employer coverage. That it's going to trump any of that employer coverage. So be sure you're asking your retiree folks that question. All right. It's important that you have a Part D plan that covers all your prescriptions. So if you've got some kind of coverage that doesn't cover all of your drugs, you really don't have the right coverage. So a lot of times people will get a Part D plan because it's got a zero monthly premium. Is that really the best choice? No. You want to get one that's got covers all your drugs. So it's better to have one that might have a low monthly premium over a zero monthly premium if it's going to cover all your drugs. Because if you've got one medication that's now going to cost you $40 a month because you're having to pay full price for it, you've lost out on the savings. TRICARE for Life is the insurance that's available to our military personnel and their families once they've retired. And it's really good, great coverage, excellent coverage, health coverage, drug coverage, et cetera. And it actually does allow people to have a Part D plan if they want to. But um, it's one of those situations where, well, is it going to pay first, or is the Part D plan going to pay first? Part D would be primary over the TRICARE for Life plan, but you don't have to have it. TRICARE for Life is considered creditable coverage. The only reason why you'd really need a Part D plan is that for some reason there was some medication that you were needing that wasn't on the TRICARE for Life plan. Veterans, this one's going to be a little bit different. If you are eligible for VA coverage, it's just like it is with the health coverage. If you want VA to pay for it, you need to get it done within the VA system. If you want Medicare to pay for it, then you would have to enroll in Medicare. You'd have to have Part A, Part B for Part B coverage. You'd have to enroll in a Part D plan if you wanted Part D drug coverage. The two systems are completely separate. So you need to make sure that you understand that whatever you're getting done within the VA system, you would work within the VA system. And then Medicare is separate and you would get done outside through the VA system. So just be aware of that and work within those systems. Indian Health Services. Indian Health Services, as I said within other Medicare Monday webinars, it's the payer of last resort, even after Medicaid. It is considered creditable drug coverage, all right? But it doesn't necessarily cover every prescription that is out there. So it's something that you want to keep in mind. You may need some prescription that's not going to be covered through IHS or through your tribal drug coverage. So it's something to consider getting a Part D drug plan. As we've said in an earlier slide, there are zero monthly premium plans out there that give really good drug coverage. Plus, instead of IHS having to pay for that prescription, if you enroll in a Part D plan, that's actually bringing money into the tribes, money that can be used to make improvements within the clinics and things like that. So we encourage a lot of times, and if you talk to representatives from the tribes and the patient benefit coordinators and folks, they'll tell you this is a great way to bring money into the tribes and needed income and stuff. Let's talk about Medicaid just very quickly for a second. I want to make sure that people understand if you're working with someone or you know someone who is on Medicaid, don't assume that Medicaid is always going to stay your coverage. Once you reach the point where you are eligible to receive Medicare, Medicare is going to become your primary. And one day you're going to walk into the pharmacy and try to fill a prescription, and they're going to say, oh, wait, you're now eligible for Medicare. We can't fill this because your Medicaid is now secondary. So that's going to mean that now, boom, not only do you have to enroll in Part D, but before you can enroll in Part D, you got to have, guess what, Medicare Part A or B. So be thinking about that. You need to make sure that you got all your ducks in a row so that you can get enrolled in Medicare whenever you need to. Very quickly, I want to talk about GLP-1s because it's been in the news. Most people are aware of this change, but it is pretty significant. GLP-1s have actually been covered by Part D plans for a while now. The coverage so far has been for things like type 2 diabetes, moderate to severe sleep apnea, fatty liver disease, and certain heart disease risks. And they were covered through Part D of Medicare. They weren't covered by A or B. It was specifically through certain Part D plans. So anyone who had one of these conditions had to make sure that their Part D plan provided that coverage. Now there's a GLP-1 bridge program that is specifically for the purposes of weight loss. That was not one of the covered benefits through Part D. And this is very different because that is not a covered benefit through the Medicare program. Now, here's how it works. A person has to be enrolled in a Part D plan. However, their Part D plan does not carry the risk for this particular benefit. In other words, it's not going to go back to your specific Part D plan. There's going to be a single processor for all the claims for this benefit. Once you are approved, and we're not going to get into the whole approval process because it would take too long and we don't have time, the pharmacy will collect a $50 copay once you've been approved for this program. There's a process that you have to go through, but they would collect a $50 copay per month for your medications. The costs for the medication do not count toward the troop. So that $2,100 that we talked about earlier, this $50 would not count toward that because it's not part of your Part D plan. All right. Now, the beneficiary requirements are, like I said before, you do have to have that Part D or Part C drug coverage. You got to be at least 18 years old at the time that you initiated GLP-1 treatment. You have to have a body mass index greater than 35 at initiation, or 30 greater than 30 with a diagnosis of uncontrolled hypertension, heart failure with preserved ejection fraction, or chronic kidney disease, or greater than 27 with prediabetes, history of heart attack, previous stroke, or symptomatic peripheral artery disease. The drugs that are included in this program include Foundayo in the pill form, Wegovy injection or pill, or the Zepbound Quick Pen. So this was down and dirty, folks. This is nowhere near all the information. If this is something you think you would be interested in, you need to talk to your doctor. They've been educated about this. They would write the script. You would have to take that to the pharmacy. The pharmacy would then send some information to Medicare, and that would get the process started. Now, extra help. I want to touch base on extra help very quickly. This is a really great program, folks. If you're on a fixed income, you've been working your whole life, and now you're not getting any more raises, and you're on expensive medication, this is a program that can help you. The income limits for 2026, if you're making $23,940 as a single individual or $32,460 as a married couple living together, or and including resources of 18,090 or less, or 36,100 or less as a married couple. And keep in mind, this does not include the home you live in. This doesn't include the car you drive. It's worth checking into. If you qualify, this is going to pay all or part of your monthly premium. It significantly reduces your copays. In Oklahoma, we've got 3 benchmark plans. There's 3 different plans that are available that you would pay a 0 monthly premium. Your copays would be $5.10 for generics, or $12.65 for brand name drugs. So this can really, really, really save you an awful lot of money on your medications. It can be the difference between buying your meds or buying your groceries. Now, for some people who are on more expensive medications, they may not want one of those benchmark plans. If they qualify for extra help, they'll still pay money toward your monthly premium. It may not eliminate your monthly premium, but it would dramatically reduce it. So it's still worth it to check out whether or not you would qualify for this program, because it can really, really, really be a lifesaver. Some additional benefits of this extra help program is, if you're somebody that delayed getting enrolled in Part D because you didn't think you'd be able to afford your medications, guess what? It would eliminate any Part D late enrollment penalty that you might have incurred because you did delay enrolling. Also, it gives you a special enrollment period to enroll at any month during the year. If most people have to wait till the annual enrollment period if they didn't enroll when they were supposed to. Well, if that was the case, now you can enroll in any month during the year. Or let's say that the doctor made some medication change and it's not on the formulary for your current plan. This being enrolled in Extra Help would allow you to make a change in the middle of the year during any month. So it's a great program and it's well worth the time and energy to get involved. Uh, as far as assistance to get enrolled in Extra Help, there is multiple ways that you can do this. One, you can go to the Social Security website. They've got a place where you can do the application right there online for the Extra Help program. Also, there's another website called benefitscheckup.org. What's neat about this website is not only can you apply for extra help, but it's sort of an all-encompassing application website where there may be other programs besides just extra help that you can check into that are based on income that you might qualify for some other kind of assistance for programs other than just prescriptions. There's a really great publication that Social Security does called Understanding the Extra Help Program with Your Prescription Drugs. It was just updated in January. Here's the information for it. You don't even have to get the paper copy. That's the link to where you can actually read it right there on your computer screen and learn all about the Extra Help program. So I encourage you, take the time to read it. Very useful. You can get the paper copy if you want to order it. They're happy to send it to you. Now, obviously, we want you to call us. We're happy to help you do that application. That's our phone number. That's our email address if you'd like to reach out to us via email. Also, our partners over at DHS are partners with us on our MIPA grant. That's the grant that helps us with the information on the Extra Help program. Oklahoma Human Services, the Medicare and Medicines program. I want to share with you that's their website, but here's a map. Look at this. If you live anywhere in Oklahoma, this on this colored map, and then you can see there's the phone numbers you can call based on this map and talk to somebody. They would love to help you fill out the application and talk to someone about other assistance programs. There's all sorts of things that are available in our state that might be able to help you. And I know, folks, it's on the news right now about how long it is taking to get assistance. People are very, very uh, busy right now and trying to get paperwork pushed through and stuff like that. If you'll just be patient with people and give them time to help you, uh, they're working as fast as they can to try to get this stuff done. But let us help you get this process done. We're not part of that part of the program, so I think we can probably help you get some of that stuff done as far as prescription drug medication applications more quickly, because this is not Medicaid. Now, this is our partners. These are the AAAs and some of the community action agencies and stuff that we work with that can also help you with those applications. So if you live in these counties, please, feel free to reach out to these agencies and talk to them about these programs or any other questions that you have about Medicare. They would be happy to help you. And I think we are to the point now where we can take questions. Rachel, do we have any questions that we need to address?
We do have a couple questions. So the first question is back to one of the first slides talking about the deductibles. And the question is the deductible and out of pocket for individual or for family?
Oh, it's definitely for individual. For the Part D prescription drug plans, it doesn't work like it did when we had employer coverage. Every individual on Medicare will have to have their own Part D prescription drug plans. In a lot of ways, that works to your benefit because you may be on certain prescription medications, but your spouse will be on completely different medications. So this way, you guys can get a Part D drug plan that works best for both of you. So your deductibles will be separate.
Perfect. And then our last question is regarding those emails about better coverage. And the question is, if you get a call asking to give you better coverage, how do you verify if they're valid or if it's something that could potentially, be a scam or not correct?
Okay, I love the way that you asked that question because it lets me talk a little bit about fraud. Here's the deal. When we're talking about fraud and when we're talking about telephones, a lot of times when we're talking specifically about seniors is if you don't know who's calling you, you don't necessarily have to answer that phone because our phones are ringing off the hook. And I get so many calls all day long uh, from people I don't even know, and they're all trying to sell me stuff. And I I try not to answer the phone if I don't know, if I don't recognize the number. If it's important, they will leave me a message and I will call them back if I feel that it's important. Um, if they're trying to sell me something and I don't know who they are, I choose not to deal with them. My concern is this: a person can be licensed to sell insurance in the state of Oklahoma and not be located in the state of Oklahoma. That's not necessarily a bad thing, but if you don't know where this agent is located, how are you going to hold them accountable for what they're saying? How are you going to know anything about this person? If you have a problem with your roof right now, don't you like the fact that you can go down the street and talk to whoever your homeowner's insurance agent is or your car insurance agent is? I would feel uncomfortable speaking to somebody about my insurance that I didn't know or I didn't know where they were at. I feel like you really shouldn't be doing your business with someone who cold calls you out of the blue. Do your research first. You make the phone calls. You can contact the Oklahoma Insurance Department and ask about somebody's license. Get their name, find out information about them, put them on the spot. It's fun. Uh, and learn about who this person is because you don't want to just buy something out of nowhere. Anything else?
Yes. So hang on, I'm reading the question that just came in. It's a long one. Give me just a second.
Okay.
Okay, so this question I think is going to be, it's pretty individual specific. And so I'm going to recommend that this person go ahead and email or give you guys a call to
That sounds
get an
good.
answer to that question. So if you want to reach out to MAP via email, you can email them at map@oid.ok.gov and they will be happy to get you that more individualized response.
All right. That sounds great. Folks, I appreciate you tagging in with us today, and I look forward to seeing you guys again next month. Please stay out of the heat, folks. This is not fun. I don't know about you guys, but our power keeps glitching off at least once a day. We just kind of run bets as to see whether it's going to be in the morning or the afternoon. So you guys try and stay cool, and we will see you again next month. Bye bye.